Thank you, chairpersons, for the opportunity, and I thank the organizers for allowing me to join today. So, we have a very interesting study, which is an abstract presentation, which is a KEYNOTE-A39, which is a open-label randomized phase 3 study of a drug called as Enfortumab Vedotin, now in combination with pembrolizumab, that is a ADC plus a IO versus standard chemotherapy in the previously untreated locally advanced or metastatic urothelial cancers. So it was presented in ASMO as a 23 as abstract LBA6. So coming to the study, the platinum-based chemo is the standard of care for any locally advanced or metastatic UCs. But still with that, the long-term outcomes are very poor, so it remains an unmet need. So here we present the study where EV plus pembrolizumab was compared to a normal platinum doublet. So if we discuss this drug, this is Enfortumab Vedotin, which has got an accelerated approval. It is basically a ADC directed against Nectin-4. So in this, patients were randomized 1-to-1 with the drug EV on day 1, day 8, and pembrolizumab on day 1 only against a day 1, day 8 gemcitabine cisplatin or gem-carbo combination. Dual primary endpoints were PFS by RECIST version 1.1 by BICR and OS. 886 patients were randomized 1:1. Patient characteristics were well balanced between the arms. At data cutoff, median follow-up was 17.2 months. PFS was significantly prolonged in the Immuno plus ADC arm, reducing the risk of progression or death by 88%. The median PFS was 12.5 versus 6.3. So this is the graph of PFS. Risk of progression or death reduced by 55%. So doubling of the curves at around 17 months, which is quite interesting. Coming to OS, OS also was significantly prolonged in the arm by reducing the risk of death by again 53%. The median OS was 31.5 months versus 16.1 months in both the arms, which is again a doubling of the OS in this. So here we see this. And another thing was the study was the PDL1 expression was not taken as inclusion, but when they have studied against the PDL1 low versus high, there was no significant difference in the OS curves. Coming to TRAs, the most common grade 3 TRAs of special interest for the ADC, including skin reactions, peripheral neuropathy, and hyperglycemia. And the most interesting AE of special interest for the Pembro addition was also skin reactions. So skin reactions were very, very common in this. And otherwise, the grade 3 reactions was around 55.9% in the ADC plus Pembro arm versus 69.5%. So nothing, no new signals here. So coming to the conclusion, if we see now we have a very interesting doublet, which is we have always had chemo immuno. So now we have a ADC immuno doublet, which is very interesting. So it has basically doubled both the PFS and OS. The safety profile was quite manageable, and it might be one of the new treatment of choice for a disease which has a very poor outcomes. I'm really sorry for not coming in person due to some problems, and thank you for this opportunity.